Dr. Quinn, thank you for joining us this afternoon.
Hey, thank you for having me.
The Gallup poll that we are referencing indicated 58% of Americans now think the coronavirus situation is getting worse. So, Dr. Quinn, what do you tell those people?
I just advise them, I encourage them to just hang in there and hold on and continue to follow the science. Get vaccinated if you have not already done so. Get that booster if you're eligible. Follow those mitigative measures like wearing masks and social distancing when you can, but also tell them that I understand and I too am frustrated. I'm tired. I want to take my wife out dancing, just go to a nice restaurant and just have a great evening, but we just have to stay the course because things are going to get better, but we just have to weather this storm.
Well, a number of people who are fully vaccinated have contracted Omicron, and understandably, many are frustrated. What do you tell them again about what they should do, who are just frustrated, who are doing what they consider the right things?
Right, and that's very understandable because early on in the pandemic, when we first got the vaccines approved, we were telling people, hey, get vaccinated, it can protect you. But as time went on, what we noticed was we had a lot of breakthrough infections. And then with this Omicron variant, we have even more breakthrough infections. And these are infections of people that did all the right things. They got vaccinated, they got their booster, and they still got coronavirus. And they're like, Dr. Quinn, you told me if I get vaccinated, I was safe, but now I have coronavirus. I'm frustrated. But what we tell them is you have to follow the science and the data. And overwhelmingly, the people that contract coronavirus and get very sick, resulting in hospitalization, ICU, and or losing their lives, they were not vaccinated overwhelmingly compared to those that were. So the vaccines still provide a great deal of protection and a high level of confidence that you'll have a much better chance of not getting sick. So I share this with the patients and the people even at the grocery stores that approach me, and I just tell them to stay the course and understand that we're gonna get through this.
Similarly, some are questioning the effectiveness of the vaccines. Any words of wisdom that you can share there?
Well, as I said before, we just have to follow the science, follow the data, just follow what's really going on and look at the people that are getting very sick, the people that are losing their lives. Overwhelmingly, these are individuals that haven't been vaccinated. So just encouraging people to just get those vaccinations, continue to follow those mitigative measures, wear your mask, social distance when out in public, and understand, look at the data. A lot of people that are getting coronavirus are not getting as sick as with the Delta variant, which was the previous variant. So that's encouraging. But really, a lot of the frustration is people were getting better. The infection rates were down. Now they're up with this new variant. It's almost like a roller coaster. But as it goes up, it's going to come down. It is starting to come down in some parts of the country. Things are going to get better.
There's still a lot of controversy over the idea of wearing a mask. Health experts recently stated that cloth masks aren't effective against the Omicron variant. What is effective?
Well, during this coronavirus pandemic, what we have to do is we have to do everything we can to put ourselves in the safest position that's possible. Now, ideally, everybody will wear an N95 mask. That's the best protection as far as a mask that we have, but everybody can't afford an N95 mask, especially people that have big families with a lot of children. Now, the second set would be the surgical mask. That's the second most effective. But if you don't have anything but the cloth mask, that's better than nothing at all. But what I advise is at least double it up. If you're making masks out of T-shirts, maybe 2 or 3 layers, but make sure you can still breathe, especially if it's for a child, make sure that child can breathe. But like I said, we will get through this pandemic.
There's a lot of debate. Should kids wear masks at schools? And if so, what kind? Because a lot of debates whether they should have masks in schools now or not.
Right, most definitely. Children should wear masks in school. The scientific community is overwhelmingly advocating for this. But as I said before, it would be ideal for the N95s in the event that N95s are not accessible. The surgical mask would be the second best choice. But if you have to wear the cloth mask, at least do 2 to 3 layers, but make sure the child can breathe with this mask that might be homemade mask from home. But understand that something is better than nothing because we want to provide the highest level of safety possible, especially for our children.
For those who are saying, we're doing all this, but nothing is working, we're still out here, everyone's getting COVID, it's going back and forth. I hear you, Doc, but, we're getting COVID, we're masking up, we're taking the vaccine. I don't believe anything that you're saying. What do you say to those folks?
Well, as I said before, I just have to maintain my high level of encouragement and just share that things are going to get better. And actually, some of the reports are showing in some of the states in the United States and some other countries, the peak is starting to plateau, meaning that there's not a higher number of infections per day. So it looks like we're coming to a better point. So we just have to stay the course and follow those recommendations. And I'll just say it again, things are going to get better.
Dr. Timothy Quinn, always a pleasure talking with us and giving us good information. Thank you for joining us this afternoon.
Hey, thank you for having me.